There we go. Good morning, everyone, and welcome to this special WIOA Wednesday webinar. It's not Wednesday. This is a special feature that we are offering on Friday. My name is Kirsten Bayer with the Illinois Center for Specialized Professional Support at Illinois State University, and I will be the moderator and technical support for this session. So if you have any technical issues, please feel free to reach out to me via the chat, and I will help you solve those. Today's topic is WIOA notice for the safe reopening of the AJCs, and we will be hearing from Bethany Yeager and Mitch Parrish from KEB. So Bethany, you can go to the next slide for me, please. Just introducing myself and our center, and then we will get started with these polls in a second here. Just a couple of housekeeping things. A reminder, this webinar is being recorded. The presentation recording and the materials from today will be available on Illinois WorkNet within 48 hours. And in an effort to be as accessible as possible, this webinar is offering closed captioning. Unfortunately, Zoom closed captioning isn't as accurate as we would love it to be, but it does do a pretty good job. You'll notice at the bottom if you're following along, but we will have accurate transcription on the recording of the session. So if you need that or know someone who needs that, feel free to access that on the recording for complete accuracy. But hopefully these closed captions will be good for the live session. And then at the end of this session, we will not be offering a survey like we typically do. So if you're curious about that, that's just a little tidbit that we're not actually going to have a follow-up survey. So don't be looking for that like we normally would on our WIOA Wednesday webinars. And then a reminder, if you have a faulty internet connection or if you prefer to call in, you can do so using the phone number in your original registration email that was sent to you for this session. And so with that, I'm going to start us off with our beginning polls. The first one we have is just where you're joining us from this morning. So where's your local area? We have Chicago, Northern Illinois, Central, Southern, and statewide. I am joining you from Central Illinois this morning. Our center is located in Normal, Bloomington Normal, but we are still working from home. So I actually reside in Decatur, Illinois. So if anyone else, all my Central Illinoisans I see answering the chat, welcome. And I know Bethany and Mitch are joining us from Springfield, so that's Central Illinois as well. So we'll give everyone just a few more seconds here and then share the results. So we do have mostly Central Illinoisans. Courtney, thank you. Joining us from Rockford, welcome. And everyone else is sprinkled. We even have a couple people, 6 people joining us from out of state or statewide, so welcome. And then our last poll, Bethany, if you want to go to the next slide, is which partner do you best represent? So Title I, 2, 3, other WIOA partners and stakeholders, etc. We'll give everyone about 30 seconds to answer this poll. And these are just for our analytics so we can kind of gauge our audience. Okay, so most of you are joining us from Title I this morning. And the rest of you are sprinkled other titles and WIOA partners and stakeholders. So welcome. Thank you so much for taking the time to answer those beginning polls. And I'm going to hand it off to Bethany and Mitch.
Good morning, everyone. I'm Bethany Yeager with KEB, and I am here with Mitch Parrish, also of KEB. We help facilitate the interagency teams that help provide guidance such as today. And today we know has been a long time coming. We know you've been looking for guidance about how state decisions are made regarding the placement of staff back into the American Job Centers as the pandemic continues. And we understand there are a lot of questions. So The notice was issued formally yesterday, and today is the presentation of the notice. And our goal today is just to provide as much clarity as possible on what the notice says, how it applies to the different types of centers, and then offer an opportunity for you to ask questions. And today, because of the Zoom webinar format, we are going to ask that you type all of your questions into the chat box. That way, we'll answer them as we can, and any that we cannot answer today, we will at least have in writing so that we can address them after the webinar and in partnership with the WIOA Interagency Technical Assistance Team, and get those responses back out to you all as soon as possible in a way that's consistent. So we'll go over some background about how this notice came about. We'll walk through the notice and the way that the requirements apply to different centers. And then we will walk through the form. Mitch will tell you a little bit more about what's in the form that is required to document a plan for reopening and all of the steps that are taken in that process. And then we'll end today with question and answers, again, asking your questions in the chat, and we'll just answer them the best that we can. So at the start of the pandemic, as you may recall, more than a year ago, this guidance was issued first. It's called the Checklist for Reopening American Job Centers in Illinois, and it was in accordance with the Governor's Restore in Illinois plan. So the phases that you saw in the Governor's Restore Illinois plan were carried through to the document that's called the Reopening Checklist to see how those phases applied to the local workforce systems. And the WIOA Interagency Technical Assistance Team developed this checklist with input from you all and the partners from around the state to say what questions you had, what guidance could be helpful, what are the knowns versus what are the unknowns. And then again, just simple things like what is the availability of PPE and should you procure that locally, or was there an option to procure that in a different way with the state's help? Just all those early questions of the pandemic generated this initial checklist. And this was issued first in May 2020. And then it has been updated periodically, again, based on input from all the partners around the state, just with their questions of how to actually apply it. And maybe what was unclear, or maybe what could have been needed a little more flexibility to allow you to fit your circumstances locally. So the most recent update to this checklist, which is called the Reopening Checklist for short, was done in March 2021. And it is located on Illinois WorkNet under the resources where the governor's guidelines for MOU negotiations are found. So that is an ongoing resource for you. All that guidance is still active today. And it's mostly guidance. There were 3 minimum criteria that were to ensure that PPE was available for anyone who was in person, including staff or participants and customers. And the second requirement was that ensuring the safety of the staff and the customers, looking how security of those was routinely assessed. And then the third requirement was establishing an agreed upon process for making decisions about reopening in any capacity, whether that's limited service hours or open to the public or by appointment only, whatever it was. The intent of the guidance back last year was to say there needs to be agreement around the table about how to do that. We know that happens in various ways, and things evolved so quickly throughout the pandemic that we understand circumstances just arose. But this resource, the checklist for the reopening checklist, is still considered a guide for you that's available through the duration of the pandemic. And I'll highlight just a few things that are in it in case you have not reviewed it. It was primarily focused on pandemic-related health and safety concerns. But all of the guidance was linked to existing guidance so that it coordinated with. It did not contradict guidance that was issued by the state of Illinois or by the Illinois Department of Public Health or CMS or even federal guidance. All of those links are embedded within this reopening checklist. And it goes over health and safety protocol, thinking about PPE or screenings, staffing considerations about how your staff could interact with customers if there was any tension over wearing masks or just tension with the situation that that customer was in. Sample signage or sample job descriptions of security officers or supervisors that would oversee some of these new protocols that were born out of the pandemic. There's also some sample tools and talking points. So all of those are still available to you if they're helpful to you. But we know since all that guidance and since we've lived through more than a year of the pandemic, significant questions kept arising. Decisions for when the state agency would need to make a decision versus when the local area could make a decision, or criteria for when centers were considered safe enough for in-person services or staff to return on site. What was considered safe enough and what was the criteria around that? We also knew that there were a lot of questions about how criteria could possibly apply to the different types of centers that are out there. For example, if the state agency was a leaseholder versus whether someone else, another entity, a non-state agency was a leaseholder, or whether state employees were physically present in that center or not. If they're not physically present, then what are the criteria for deciding when a center is okay to reopen? And then, of course, all the legal implications of all of the above, and what the state's legal implications were, and what the local area or the one-stop operator or the non-state agency leaseholder, those took a lot of consideration before guidance could be issued, which is why we went through the process that we did. The draft notice that we're presenting today and that was issued yesterday is the result of numerous meetings between interagency representatives on the WIOA interagency teams, as well as state agency directors and executives, and as well as the Illinois Community College Board executives and administrators, and then also from the legal teams of each of those entities. So there has been a lot of work to try to think through the different scenarios around the state and how guidance could be issued in a way that was as uniform as possible, but understanding there are different nuances in every area. So the purpose of this notice is to spell out what those additional criteria are for how state agencies and others will make decisions about when staff can return to on-site in the American Job Centers, and then what minimum criteria and requirements must be met before the American Job Centers can be announced as fully open for in-person services. And we know certain centers are already open in some capacity, so this notice will address that too. We'll walk through that today. Then, as part of this notice that you'll also hear about more today, is a required form that will be required to fill out in partnership with each other, your partners in the local area, and sometimes state agencies when applicable. And that has to be submitted to the state, and we'll go through that process. But that is part of this WIOA notice, is that required form, which is the document that spells out your reopening plan. So to start, the notice, the WIOA notice that was issued yesterday, describes some requirements that are applicable to all centers, regardless of what type they are. Because there is precedent in the way that you negotiate MOUs for how you deliver services and how you share costs in your local workforce system, the MOU process can provide some existing procedures to follow for what we're asking through this notice. So we're saying use your current MOU procedures to guide and govern your negotiations about how you're going to plan the reopening. Then the form is required for every type of center that plans to open to the public, provided with this notice. And then the process is that once that form is completed, it's submitted to the state of Illinois through that WIOA Interagency Technical Assistance Team email address that you already use for the MOUs in your regional and local plans. So it's the same general inbox that then the WIOA interagency team members have access to so that we can review those plans. The plans are, to be clear, the plans are to be approved at the local level, but they are submitted to the state of Illinois at the WIOA Interagency Technical Assistance Team so that the TA team, for short, can review those plans and help monitor the implementation of them, and also provide support as you really begin to implement the plans. So local decision-making about the plan, but submitted to the state for monitoring and support. The thing about the plan is that it must be agreed upon before announcing a public reopening, if you're not already open. And the intent is to have collaboration between the leaseholder, whoever that is, the one-stop operator, and the program partners that have a physical presence in that center or that plan to return to that center when this plan is approved. So it's intended to be collaborative. For the centers that are already open in any capacity, again, whether that's by appointment only or limited service hours or open full force, then this slide applies to you, and this is spelled out in the notice, that because you're already open in some capacity, we're applying a 30-day timeline for you to fill out that required form that spells out your reopening plan and submit that to the WIOA Interagency TA team. And because 30 days from yesterday, yesterday was June 24th, 30 days from yesterday is Saturday, July 24th. So then we'll say your reopening plans that are agreed upon by all the partners are due Monday, July 26th. We'll make sure that that date is known and support you in doing whatever you need in order to get that plan approved locally and submitted to the state in time. And because this is being issued through a WIOA notice mechanism, then the state has the ability to monitor the compliance with the notice and the required form. These are a few more requirements that apply to all the types of centers under this notice. Unanimous approval is required at the local level of all the program partners that are physically located there. So, number 8 on the slide says, if state agency employees are physically present now or plan to be based on this reopening plan, then yes, the state agency directors or their designees have to approve that local plan because they're representing the local program partner. So unanimous approval by all the partners that have a physical presence or planned physical presence in that center. And that may include a state agency director or designee. Number 9 is that the form is going to be signed by the local workforce board chair or chairs or co-chairs and the chief elected officials. And this is a way similar to what you've done with MOU negotiations and maybe report of outcomes or other documents that are required through the MOU negotiation process. Their signatures then represent that all the partners have agreed to this. If you can't agree, there are some processes spelled out in the WIOA notice, starting with number 10 on the slide. Your MOUs already have a section that spells out what to do if you don't agree on the MOU negotiations. And this is saying use that same process to try to reach agreement and overcome any disagreements using that procedure that's already spelled out in the MOU section 5. You go through that process locally and you still can't agree, then it's similar to your MOU negotiation process. it would then be elevated to the WIOA Interagency Technical Assistance Team, and they may convene, as we do with MOU negotiations, what's called a state-level remediation team. And that is an attempt to just facilitate agreement and elevate issues to state agency directors if needed. So if agreement is still not reached after the Interagency Technical Assistance Team gets involved, then the directors or their designees may need to get involved. And then if agreement is still not reached, if the state agency directors aren't facilitating agreement, or if agreement is not reached between agencies, then the governor or its designee would get involved. Just like the WIOA infrastructure funding mechanism, this is following the same procedure. So this process, just again to be clear, is outside of your MOUs at the moment, but you're still using similar processes and protocol in order to try to reach agreement on reopening plans. And this is the last series of general requirements that apply, again, to all the centers that are listed in your MOUs. The partners that are identified as providing services in your MOUs through direct linkage. So if a partner in the MOU says, we're only going to provide our services using direct linkage, that's fine. And what this notice is saying is that those partners that are offering services through direct linkage, they should be notified of the reopening plan, but because they don't have the physical presence there and don't plan to have the physical presence there, they can't cause disagreement and hold up the reopening plan process. Number 14 is that just because this reopening plan is spelling out a plan for reopening, it doesn't mean that all the partners have to be physically present at the same time when the doors open in any capacity. The reopening plan is okay if it says some partners will be on site. For example, Title I-B partners may be on site, but then unemployment insurance may be off-site for the time being. And that can be built into the plan. And as long as everyone agrees to that, that's fine. So you have to agree locally, and then again, when state agencies administer programs such as unemployment insurance, then the state agency directors have to get involved. But it's okay if you're returning to the on-site physical presence at different times, as long as everyone is aware of what the plan is. We also understand, obviously, things will change over the next program year, especially as the pandemic unfolds. So this is to say that state agency directors may have to decide at some point after the reopening plan is already implemented that they have to change whether state employees are put on site or pulled off and working back remotely if they know of certain security concerns or if there are additional health concerns, whatever the circumstances may be. The plan, we understand, may need to be modified. And therefore, the reopening plan, if that were to occur, would just be filled out again and resubmitted to the state as modified. Now I'm going to spell out some of the scenarios. There are 4 scenarios defined in the WIOA notice, and we're going to go through each one so you know how they apply to the different types of centers that are documented in your MOU agreements. There are, we know, again, the types of centers that this applies to are comprehensive one-stop centers, designated affiliate centers, designated specialized centers, and out of the safety concerns for in-person unemployment insurance services, this notice also adds the category of where in-person UI services are offered. So it's all the centers that are required to be part of your MOU because they're comprehensive or designated, specialized, or affiliate, and then adding the category of in-person UI services. All other centers, and they're called access sites that are defined on the WIOA glossary, libraries is an example. Those all are mentioned in this WIOA notice, but the state's authority and the liability over those centers is different. So there are sections that describe how this notice applies to those other access sites. And I'll go through that in a minute. But this slide that you see here shows you what the scenarios are. And let's go through them one by one. This is scenario A, so the first scenario. So start by looking at the boxes on the upper right hand of the slide, those clear boxes. Those are the types of centers that this scenario applies to. They're comprehensive one-stop centers. State agency is the leaseholder. State agency employees are present or planned to be present when an on-site reopening plan is approved, or in-person UI services are offered. So those are the types of centers that this scenario A encompasses. Then the very specific centers that apply under this category of this scenario are listed on the slide in the blue box. And this table is in the WIOA notice. Now look to the left-hand check marks on the slide. When your center is listed as one on this box in this scenario A, the first scenario, then the check marks apply to you. That CMS security assessments are required, and all of the security assessments for the centers listed on this slide have already occurred. And that came out of a concern for safety, the physical layout of the building, the way in which the employees are separated or not from the customers, the security parameters around the centers, and other factors. So these security assessments are looking for those types of factors and how that applies to the security of the physical location where employees would be present. So the CMS Security Assessment was required and already completed. Also, because it's a state-held lease, and because state agency employees are physically present or plan to be present, then yes, the state agency director or the designee has to reach agreement on that local reopening plan. And then the state agency, as part of that reopening plan, will decide when staff will return on site, if they're not already. Then again, as I mentioned earlier, the state may have to change at any point if circumstances change regarding whether the state agency staff are still physically located on site or not. So this is the first scenario A, and there's a 1 in parentheses because this is the first set of centers that apply under scenario A. Now let's go through the second set of centers that apply under scenario A. I know it's a little confusing, but just hang on there. We'll walk through it. Look again at the upper right-hand side of the slide, those clear boxes. This scenario A still applies to these types of centers. They're comprehensive one-stop centers. The state agency is still the leaseholder, and the state agency employees are present, and in-person UI services are available. So the same requirements apply to these, looking at the left-hand side of the check marks. They have to have a CMS security assessment that's going to inform the state agency directors about the safety protocol of that center, the layout of that center. The CMS security assessments are already done with the exception of Decatur. Decatur is scheduled for June 28th, the last we heard. So other than Decatur, all of those assessments are underway or completed. And then Decatur's comprehensive one-step center will be assessed on June 28th. So all of these on the slide will now be assessed already by CMS by June 28th. So yes, state agency directors or their designees have to approve the local reopening plan. And yes, state agencies, directors or their designees will decide when the state agency staff are placed back on site. And then state agency directors or designees can decide later on during the program year, it's time to change, and those employees can be placed on or removed remotely. And that reopening plan would have to be modified. I'm going to keep going through the scenarios, and then we can pause for questions, but just bear with me as I spell out the rest of the scenarios. Now we get to scenario B, and again, this is described fully in the WIOA notice. On the upper right-hand side in those clear boxes, this scenario B applies to when it's a comprehensive one-stop center, but a state agency is not a leaseholder. So it's a non-state agency leaseholder, but state employees are physically present or plan to be present once this reopening plan is approved. So all the centers in this red box are listed on the slide. That same table is also listed in the WIOA notice. If you can't see the slide, just know that it's in the WIOA notice as well. These are all comprehensive one-stop centers. So because these centers are not under state-held leases, the state cannot require a CMS security assessment be conducted. However, what the WIOA notice says that even though CMS can't be required to assess the security of that center, these centers are still required, and the one-stop operators are still required to document that security was considered and assessed. Now, the CMS is going to, the Central Management Services, is going to present a webinar about best practices and its process and its tools for conducting security assessments. So CMS's approach to the security assessments will be made available to everyone as a resource, so that even if you're not a state-held lease, the one-stop operator can still use the CMS resources to consider some of the same factors of your centers. So CMS is not going to come through and walk through and do that assessment for you, but the resources will be available to support you in that process. And what this WIOA notice is requiring is that you at least document, what security assessment was conducted, by whom, and what you were looking at. So no CMS, but yes, still document the security was considered and assessed. Also, because state agency employees are physically present or plan to be present, then that means the state agency's director or designee has to approve the local reopening plan. Or they at least have to agree to it. I shouldn't say approve, I should say agree to it. And also the state agencies will decide when their staff is replaced back on site, and they might have to remove them remotely again, depending on the circumstances as the year unfolds. Okay, I'm going to go through one more scenario, and then we can pause for questions. This is two more scenarios, excuse me. This is scenario C. And up on the upper right-hand side, it tells you who this applies to. Designated affiliate sites, designated specialized centers, but the state agency is not a leaseholder, so it's somebody else or some other entity, and no state employees are currently planned or typically present in these centers. And these centers that it applies to are all in LWIA 17 in the Champaign area and are listed in the notice and on the slide. So for these centers, no, the state cannot require a CMS security assessment be done, but yes, there is a requirement that you at least document that security was considered and assessed. And just describe how that was done, knowing that CMS resources are available as a resource and a guide. And then if state agency employees are not typically present now, but if they are planned in the future, or if they may need to come in the future, that's when a state agency director or designee would need to reach agreement on that local reopening plan or a modified reopening plan, depending on when that occurs. One more scenario I'm going to go through. And this is the last scenario, D. And one example that is maybe helpful to understand is such as a library, where these are considered access sites as defined in the WIOA glossary. They're not included in the WIOA notice in the tables that we just went through. A state agency is not a leaseholder, and state agency staff are not typically present and don't plan to be present. So what this is saying is that if in those access sites that are typically not in the MOU, a security assessment and a reopening plan are encouraged, but not required. And again, CMS resources could be available to those centers for considering security. And then state agency directors or designees would only have to agree to the reopening plan or some modified plan if state agency staff were planned to be there in the future. So in summary, this is a table that just kind of spells out all the slides that we just went through and the descriptions in the WIOA notice. This PowerPoint will be available and saved online, just like it normally is, that you can refer back to this for ease of reference if that's helpful to you. All the red, if you can see red, are yeses. These are required. On the black is no's. So under scenario A, which are the blue and yellow tables we went over because they're state-held leases and the state employees are present, yes, a CMS security assessment is required, and they've almost all already been completed. It will be documented already. Oops, excuse me, I'm sorry, I didn't mean to advance the slide. The security assessment will already be documented by CMS, so that box doesn't apply to the scenario A centers. Yes, state agency directors or designees have to agree to the local plan, and yes, they have the ability to say when or state agency staff will be placed or not in that center. Scenario B, again, these are not state lease buildings, and state employees are typically present or plan to be present. So state can't require a CMS assessment, but yes, you still need to document that security was considered and assessed. And yes, state agency employees or designees have to approve the placement, have to agree to the reopening plan, and then they'll consider when state agency staff can be placed back on site. And the CMS security assessments and other assessments that are done will inform the state agency directors or designees' decisions. Then the C, scenario C, it's not a state-held lease, and state employees are not typically present or plan to be present. So no CMS security assessment, but yes, still document that it was considered. And then state agency directors or designees typically aren't involved unless that circumstances would change where state employees would be present. And then the last category is scenario D. Their affiliate, I have to change that on the slide, but they're not state-held leases and there are no state employees planned. This affiliate and specialized centers should not be here in this box. I apologize, that's a typo. Security assessments are encouraged, not required. For those who just wanted to know about the CMS security assessments, they were broken into tiers based on a variety of factors, including, the traffic control and the access to the buildings, the staffing levels that were physically present by the state agency, such as IDES or DHS or DCEO or the Department of Veterans Affairs. All those have staff physically present in some centers. The average number of participants served was looked at in those centers. The number of UI claimants for unemployment insurance benefits, geography of the center, and the partners, if there were multiple partners co-located in those centers. Those were all considered priorities for assessing the security of the physical layout and the features of allowing security of those buildings that warranted CMS security assessments. And again, these have all been completed except Decatur. Okay, so before we get to the required form for documenting the American Job Center, I'm going to glance through the questions. I know I've been talking for quite a while. I'm going to do my best to answer some right now, but then we will go on to the form and we'll open it up for questions one more time after. So if I don't answer your questions right now, just know that we'll look at them again before the webinar ends. I'm scrolling through the chat, excuse me. There's a question of whether the slides will be made available. Yes, they'll be posted on Illinois WorkNet. We're in the same places where all the WIOA webinar archives are saved, so that will be available to you within 48 hours of today. So the state agency, when I keep saying state agencies, I am using general terms, but the ones I'm talking about specifically are Illinois Department of Employment Security, the Department of Commerce and Economic Opportunity, or DCEO, Department of Human Services, or DHS, especially vocational rehabilitation, and TANF, and then also the Illinois Department of Veterans Affairs also has some staff located there in certain centers. If you have a question about a specific local area and what scenario it applies to, just keep that in the chat. We'll keep track of that, and then we can follow up with you after, and then also just know that it's spelled out in the WIOA notice. Okay, so for those who have already gotten their CMS Security Assessments, yes, you still have to fill out the form that Mitch is going to walk through in a minute. So the security assessments that are conducted by CMS are going to be written up in a report as recommendations to the state agencies that are applicable to those centers. And those recommendations will be used to make decisions about when state agency staff will be placed back on site and whether any modifications to the physical space are needed. And there is still a discussion to be had about how if the recommendations require some physical modifications, then who pays for those and how does that happen? Ultimately, immediate changes, we've been understood from IDES, likely they would cover those changes that are immediate for state agency staff to be placed back on site. However, some of the physical modifications that are recommended, but maybe not as immediate or urgent, and that maybe can be done over the program year, those likely will be subject to more partner conversations about whether there should be cost sharing for those. And right now, it's hard to tell exactly what examples are because we haven't yet seen a CMS Security Assessment report. Once we do, we'll have more specific examples to give you about the types of modifications that might be required. And I can also ask if anyone from IDES or DCEO or anyone from the interagency team who has insight into the CMS security assessments, if you want to raise your hand, then we can unmute you and you can chime in about maybe what some of those modifications would be that would need to be reflected in the reopening plans. So we also see did anyone raise their hand? I'm sorry, Kristen, I don't see.
No, no one raised their hand that I've seen.
Okay, and anyone from the interagency technical assistance team, if you'd like to enter your answers in the chat box or comments in the chat box, please feel free to do that as well. We see some concern about the timing of the reopening plan for the centers that are already reopened. So let me clarify one thing about the timing. If centers are already reopened in any capacity, we're asking and requiring that you fill out this reopening plan within 30 days. It's not that extensive of a document. And we think that you can have conversations around it within 30 days and turn it into the WIOA Interagency Technical Assistance Team. For the centers that are not yet open, maybe you're considering it, you don't have a timeline. The required form has to be filled out when you're ready to talk about reopening and when you're ready to plan that reopening with your partners. So that's, if you're not yet open in any capacity, you don't have to abide by a 30-day timeline. What we're saying is anytime that you're ready to do that, that's when you fill out the form with your partners and turn it into the state. So some forms might not be filled in and turned in for another 3 months. We don't know. It's just before you plan and announce a reopening, you have to go through this process and fill out the required form and get agreement locally from your partners. The 30-day timeline only applies to those centers that are already open today in some capacity. And if you have specific concerns about the deadline and your ability to get the agreement within that time, just please talk to us, and we'll just try to figure out your circumstances. The CMS webinar for presenting and sharing best practices around the security assessments, those are being planned now. So the date is not yet known, but as soon as we know that date, we will communicate that widely, and you'll have an opportunity to register for that webinar. And that webinar will be recorded, just like this one. So if you can't attend during the live webinar, you will have access to the recording and any resources that CMS is able to share with us. And just remember, the signatures are required of, for this reopening form, the signatures are required of the board chairs or co-chairs and the chief elected officials. It's not requiring signatures by all the required partners. I don't know yet when the CMS Security Assessment reports will be available or delivered to the agency directors. Just know that it's being expedited. This next one is something that I'll just preview for Mitch, and then we'll move on to the required form, and then I'll circle back to the questions and answers at the end of the webinar too. But one participant mentioned that the changes need to be made about how people and individuals with disabilities are served and how technology can accommodate their needs. So one thing that this reopening plan is trying to help you consider is how all of your reopening plans can ensure the safety and security also and service delivery for individuals with disabilities as well. That has to be part of the conversation. Okay, I'm going to go, I think we'll pause here. There are some other questions that, again, we will circle back to at the end of the webinar, but I'm going to move on and ask Mitch now to share with us a little more of the detail about what's in the reopening form that you fill out. It's a fillable form. So I have it here, and Mitch, just let me know if you need me to share my screen to show the actual form at any point.
Thank you, Bethany, and good morning. Happy Friday to everyone on the call here. And as Bethany mentioned earlier, the WIOA interagency TA teams together collectively developed a form to support the LWIBs, or Local Workforce Innovation Boards, in reopening American job centers to ensure the safety, all safety measures are in place. So again, the checklist for reopening American job centers in Illinois, that's in accordance with the governor's guidelines or governor's Restore Illinois plan, does remain a guiding document for this required form. So just know that. However, this new reopening plan form is required, in that previous, the previous form was more of a guiding factor and did have those 3 requirements. But this form is required to be completed by all AJCs prior to reopening their center. So as Bethany said, each LWIB must complete the form in collaboration with the leaseholder, the one-stop operator, and program partners present in each center, physically present. And the form must be completed and submitted to the WIOA plans inbox, which she showed you earlier. That email is also linked on the WIOA notice and the form itself. As stated, there is no defined due date to be completed and submitted to the WIOA inbox. However, there is that 30-day caveat for those centers that are open to the public currently. And Bethany noted that due date would be July 26th. However, please, work with us. If you're not going to be able to submit it by that due date, we'll try to do everything that we can to help you out. And then again, as noted, there's specific instructions on the form and within the WIOA notice, to complete this form and how to submit it. And then also, please note that you can submit multiple forms if, for instance, you have multiple centers or locations within your local area. You can submit multiple forms if the plan doesn't apply to each one of those centers. But if it does apply to each one of those centers, you could simply list them on the single form. So as you can see on this slide, this is just the top portion of the form, requesting information about your local area, contact information, and listing of all centers that are going to be part of the form. So next slide. So this slide is just a screenshot, but you'll see that it includes required criteria for your service locations. Please note, you'll see in each box labeled explanation. The LWIB must explain the process or procedures that are being implemented to satisfy this section. So first, this form includes various security protocol that a local must check off on. For instance, the form requests a response about the security presence, whether security is armed or unarmed, if a security assessment was completed, and if local law enforcement are aware of business hours and reopening plans. So as Bethany mentioned, this form, it is detailed and your responses need to be detailed. However, most of the aspects of the form have already been implemented through the Governor's Restore Illinois plan. So a lot of this will be information that you already have readily available or processes in place. So you may find it easier to complete and submit, once you actually get into it. Next slide. And again, this is just another screenshot of the next section, which requests explanation about the AJC's layout. As Bethany noted earlier, that was one of the aspects that CMS was looking and IDES was looking at to develop the tiered system for CMS security assessments. So a few examples here are, whether or not your staff workplaces are separated by barriers, or whether check-in procedures are in place, ensuring that accessibility and safety for individuals with disabilities is in place, and also whether any capacity limits are being followed. So just know that a lot of these things are simple responses and tell us your processes and procedures that are in place. Next slide. So this portion of the form, again, this is just a screenshot of the form, requires criteria which include specifics about your entry and exits from the AJC. I know that that is one thing that CMS is going to be looking at when they do a security assessment. And that's definitely one thing that you should be looking at if you didn't have a CMS security assessment, but you're going to do one, with your partners or with an outside vendor. So that's one, main aspect that you should be looking at. So some other examples here is whether those entry and exits are well lit, during dark hours, or whether your staff have separate entry and exits from the public customers. And again, each one of these questions is going to have a space below that you're going to be able to explain, in a detailed paragraph or more if you need it. Obviously, you can include attachments to this form that, give us additional explanation or show your protocols that are in place. And next slide. So this is the last criteria section of the form. It's just specific to supervision, which is on the top of this page, and the overall plan for reopening. The supervision criteria asks whether clear safety and emergency protocol are clearly communicated and available to all staff in the center. So this is, obviously imperative for all personnel within the center to be aware of in case of an emergency and how to react to that emergency. And then the next section below here is an affirmation from the LWIB that they have confirmed agreement between all partners regarding the policies, the procedures, the safety protocol, everything that was included in the form. And again, in addition to the required form, local areas should utilize that checklist for reopening American job centers in accordance with the Governor's Restore Illinois plan to ensure that they have the adequate protocol and safety measures in place. And that that checklist for reopening American Job Centers does have some great examples, some templates, as Bethany said earlier, as well as like signage examples. So that's a great resource for you. And next slide. So this is kind of the end of the form. You know, the reopening plan requires signatures by local workforce board chair and chief elected officials or co-chair, as Bethany mentioned. Basically, just to say that they've, you know, verified that all partners with an on-site presence or that plan to return to on-site have agreed to a reopening plan and confirm that all mandatory protocols and procedures are in place to allow for a safe reopening. You know, by signing off on the form, it signifies that the local workforce area has reached agreement on all aspects that are included within the form. And as Bethany stated, you know, if a unanimous agreement is not reached, required partners in that center should utilize Section 5 of their MOU, which is the process to be used if, you know, your MOU was not reached by partners, and try to use that section to reach agreement. Because if not, the WIOA technical assistance team, we will convene a state-level remediation team to facilitate agreement among partners in the local area. The next step would be to get director-level executives to issue a decision or to try to get the local to reach an agreement. And then the next step after that, if an agreement was still not reached, would be to have the governor or his or her designee determine a local reopening plan to ensure a healthy and safe reopening. So that kind of concludes the details of the form, and then on the bottom of the form you can see where you'll submit the form to that has the link to the inbox. And now Bethany is going to kind of walk us through some steps on how to access this form and the WIOA notice.
Thanks, Mitch. So what we thought is just show you where this is located online. We know that a mass email went out yesterday providing the link to the e-policy book. And for anyone who is not familiar with that e-policy book, we just thought we would show you briefly the online location of that. If you go to WIOA implementation, that's often where I start, simply because that's where often the governor's guidelines is located. If you go to menu, wherever you are on this WIOA Works Illinois site, the e-policy book is under WIOA resources. Go down to e-policy manual, and that takes you to this page. This is what the e-policy manual, this is the introductory page here, the landing page, and it's split into chapters. If you click these arrows, it goes down to specific chapters that relate to governance. Where this notice is located and the form are located is under 1.12, one-stop delivery system under WIOA. So if you click that, you get this page. And it starts, there's, you know, lots of different subsections to this one-stop delivery system under WIOA policy. Where you go for the notice and for the required form is over here, if you can see that. So these blue boxes, there's technical assistance resources, policy references, attachments. Notices is the box. So it looks like this. You click on notices. Here's the PDF of the actual notice. And then here's the fillable Word document for the required form. So if later on you need to go get those documents to fill out, this is where you go to get it. And then this is what the actual form looks like. It pulls up as a Word document, and again, it's fillable once you open it. Okay, so that is just where you get it. And if you can't find it, let us know. We can guide you through it. Or if you don't have access to the Illinois WorkNet site for whatever reason, just contact my friend Mitch, and he can connect you. Thanks, Mitch. Okay, I'm going to go back to the questions again, knowing that there are questions in the chat box. And if anyone joined late to the webinar, you're welcome to ask questions in the chat box. I'll do my best to answer them. Or if members of the Interagency Technical Assistance team would like to chime in, raise your hand, and then Kristen will unmute you so that you can share vocally, or you also can type into the chat box. But I'm going to go through some more questions. One question is, how do we document the partner's unanimous approval of the local reopening plan? And as Mitch just mentioned, it is through the signatures of the local workforce board chairs or co-chairs and chief elected officials. We're saying as long as we have those signatures, we're trusting that agreement was reached. Does open in some capacity, so in quotes, open in some capacity, refer to sites where staff is present but the public is not being admitted? Yeah, we are talking about staff being on site. So it's not just opening the doors to the public, but is everything in place so that staff can be returned to work on site? So if a center is not technically open to the public for, open public office hours, but one partner is already seeing customers by appointment in the building, we think that is being open in some capacity. And therefore, yes, a reopening plan should be turned around. Hopefully everything's already in place. And as Mitch said, this form is just documenting what you're already doing. But yes, you're technically open to the public if you're open by appointment only. Therefore, your reopening plan should be turned around within 30 days if possible. So regardless, another question is, if we're in scenario A, B, C, or D, whatever scenario you're in, and scenario A and B require the state agency directors or their designees to agree to the local plan. The question is, do we need the state agency directors or designees' signature on that form? No, the answer is no. You just have to make sure you get that agreement by the state agency partner, the director or designee, and then, as I said, the local workforce board chairs and the CEO's signatures then verify and are supposed to represent that we trust that you got the agreement from all the partners, including the state agencies when applicable. There are more specific questions about signatures. I am going to, we have those documented in the chat. I'm going to take those to the interagency TA team to make sure we give you the right answer in writing. Okay, Steve Martin, I know you asked a good question. I just want to make sure that we know what the requirement is before I answer it live on this webinar. So we will get back to the question, which is if the CEO board president signs for all grants on behalf of the CEOs, then could the board president sign on behalf of the CEOs, the other CEOs for this form? I just want to get back to you about that in writing, Steve, and share the answer with everybody else. Questions about customers who don't have access to technology or internet or the instruction about how to use them. If the doors are locked and those customers don't have a way to access the services, then the question is what provisions are being made to assist those who need assistance. That's a wonderful question and a serious question. I don't know that I can answer that today as part of this webinar, but please know that it's a good question that should be discussed both at the local level, and we can document that and consider that at the state level too, to see if there's any additional guidance or discussion that could inform those decisions. So another question came up about how this form reopening plan relates to your MOU, and if state agencies are not coming back in person anytime soon, but they're listed as in person in the MOU. Right now, at this moment, this notice does not require you to amend your MOU. I can't promise that won't be the case in the future. However, this notice does not require you to amend your MOU for any of the service delivery changes related to a partner reopening plan that says the state agency staff will not yet be present. Because your MOUs, the lifespan of them is 3 years, And because you already went through negotiations for the program year that starts July 1, soon, the next week, we don't want to make you redo those negotiations. This reopening plan, though, is for a special circumstance and is guiding decisions about how you're going to make those services available in the short term if you're going to reopen or change your plan, change your reopening plans. Again, if MOU amendments are required, you will receive guidance about that, and the state interagency team will work with other partners to develop the guidance that makes the most sense. I guess the bottom line is everything we're presenting today and everything that's in the WIOA notice is not intended to add more bureaucracy to your life. We know sometimes it feels that way, but it's not intended to. This is really about safety and human life and protection of customers and participants and employees. So just remember that that's really what we're going for, is making sure that people are safe when they go to work. Yeah, there's a question now about CMS workplace guidelines. The checklist, the reopening checklist cites the CMS workplace guidelines, and this reopening form, I think, cite CMS workplace guidelines, which already exist for state agencies and anywhere where CMS is technically the leaseholder. So they already have guidelines for workplace safety that are available. And what this question is asking is, will those guidelines be provided to the comprehensive one-stop centers listed in the scenario B, which is the comprehensive one-stop centers where state agencies are leaseholders? So those guidelines are an existing resource that are already available to you, and they're hyperlinked in the reopening checklist, I believe. If it's not, we can make that resource available, or at least provide the link in writing. But yeah, that's intended to be available already. You don't have to wait for that to be available. It's already available. And then anything that comes out of the CMS security assessments and recommendations to the state agencies for informing their decisions about the placement of staff, you know, that we just have to let that unfold a little bit more, because again, I haven't seen a CMS security assessment report yet. So we'll just have to see what they recommend. And also, I know we will look forward to scheduling and getting that CMS webinar scheduled so that we can hear from them directly. They've been really wonderful to work with, very accommodating to the timelines we're trying to put them under, and they have good resources. We just have to get that scheduled and get that available to you. There's a question about, I said earlier that if state agency directors or their designees are not placing staff back on site immediately, but they agree to the local reopening plan, the hope is that, you know, the reopening plans can say, this particular, let's just say unemployment insurance staff will not be physically present for the duration of this agreement. We will amend the reopening plan if we decide later that staff will be placed back on site. That's an okay statement to make as long as everyone understands it. So part of your original plan can say, we don't know yet when staff are returning on site, but we'll amend this plan when we're ready to make sure everything's in place. That's okay. So the modification would occur once you know more specifics. Or, you know, the reopening plan can say the state agency directors will return staff on site if X, Y, and Z criteria are met. That's okay. It's part of the plan. So it really just depends on what the original plan says, and you would modify it if the plan really changes. That's when the modification would take effect. And if you have questions about whether a plan should be modified or not, just contact us at KEB. We'll be a liaison to you, or email the WIOA plans MOU email address. That is a great way to make sure that we have access to the questions that are being asked and can vet them through the WIOA interagency team or other experts if needed. So if you have questions about when to modify your plan, email that WIOA plans MOUs email address that we'll put on the slide here shortly, and just ask for technical assistance around that. There was a question from Jerry about if no state employees are planned to be on site in the near future. For example, if they're not going to be until the fourth quarter of the year, could they move forward as if they're not going to be on site and then modifying the form? So I think that's what I was just saying, Jerry, is that that can be part of the original plan. Is this state agency staff is not going to be present anytime soon. So the reopening plan is just to plan service delivery around those services without them in person. And if everyone agrees to that and the state agency directors or designees agree to that, you're good to go. Okay, Mike Baker, thank you for answering. I'm sorry, I'm scrolling now. There's quite a few comments coming in, so I didn't see this till now about where a CEO agreement designates a lead CEO with authority to sign, then just the lead CEO signature is needed. So I apologize. Thanks, Mike, for closing that loop. We will share the link to the CMS guidelines. If it's not already hyperlinked somewhere else, we'll just make a note, Mitch, to have that CMS guidance for workplace safety available and distributed as part of any question and answers that is we respond to in writing after this. There are some questions specific to IDES and Wagner-Pfizer and UI, unemployment insurance. I think it's best, thank you for the question, documenting it in chat. I think it's best that we kind of take that back to IDES, and it might just depend on local area by local area or center by center. I don't know that I can give you a standard answer today. Okay, so there's a question about the confusion between a reopening plan and the required reopening plan form. The reopening plan form, the required form, it's all the same thing. Your required form for documenting a reopening plan is your reopening plan. Okay, so that form that Mitch went through and that's attached to this notice, that is your reopening plan. It's called the required form for a reopening plan. It is about safety and security. This comment says it doesn't discuss anything about the partner's reopening plan. So what we're saying as part of the notice and the guidance for how to fill out the form is that you describe the partner's agreement around those questions in the boxes. So, there's a heading to the box, then there's a field where you enter and you type in what the plan is around that topic. And that's where the plan is actually documented. Hope that's clear. Okay, I'm going to pause for a second. I also am not seeing, Kristen, is there a way to, for other people to raise their hands in this webinar setting? I'm not exactly seeing how they can raise their hands.
Yep, at the bottom of their screen, there's an option to raise their hand. So like I just raised my hand and you can see it on my picture. And then I unraised it. And I can check here on everyone's names and I don't see anyone raising their hand.
I wasn't seeing until I expanded my window box here, I wasn't seeing the raise hand option. I'm going to pause and ask Mitch, thank you. Mitch, in the chat box, just posted the link to the CMS Returning to Work Guide for employees. Again, that's been a resource that's been out for a while, and that hyperlink is there in that chat box. And we can make sure that we could embed that in the form that's posted online too. The day of, there's a question in the Q&A box about to which core partners are the CMS assessment reports going to be disseminated to, and when will those reports be disseminated, since the clock is ticking now. If a center is already open, they have 30 more days, until July 26th to turn in this plan. But if the CMS reports are not available yet, then how can they fill out some parts of the plan? It's a fair question. I don't have the answer. Does anyone from the TA team have any insight about what we can say about the timing of the CMS security assessment reports that are delivered to the state agencies? Either in the chat box, and if not, then we will do our best to keep asking the question and share the information when it's available.
Hey Bethany, it's Janice. We don't have that information currently, but as soon as we do, we'll send that out.
Thank you. We'll do our best. Thanks, Janice. Okay, I think I scrolled to the bottom of the chat box. I may not have answered every question, but that's, again, they're documented in the chat box, and we have them in writing, and we'll try to get back to you all in writing with clear answers. Is there anyone else that has a question that you would like to put in the chat box now? Is there anyone else from the TA team and the panelists that would like to offer anything else? I know we went through a lot of information, and I've been talking for a while. If there's anyone else who would like to chime in with some refreshing highlight, just. Mitch also did just place in another hyperlink in the chat box of the CMS Return to the Workplace design guidelines. So designing around safe, and a lot of those were from the angle of health protocol, especially with social distancing at that time. So that angle, but it's there, it's available as a resource, but we know that it was a lot related to the health protocol. Any other questions? All right, well, thank you, and please don't be shy. Any questions you have, you can contact your people you typically contact at your own authorizing agencies, or please use that WIOA. Mitch, would you be able to put that email in the chat box? Just, I keep flubbing what it actually says. It's WIOA plans MOUs. And that email address, again, is a really great place to email so that we get all eyes on it to make sure that we can answer it. I can scroll up too. Here's my scrolling. Here.
Do you have a raised hand, Kit White? I'm going to
Okay.
allow you to talk, Kit.
Sorry, I don't know how I clicked that. That was an accident.
Oh, no problem.
You can just give me a thumbs up, Kit. That'd be great. Okay. Anything else, Kristen? Did I miss?
No, I don't believe so.
Okay, everyone, thank you for your patience with this notice, and please just contact that email address if you have any questions. We'll do our best to get you responses in writing. Thank you very much. Good rest of the day.
All right, thank you, everyone. Have a great rest of your Friday and a great weekend.